Howdy, folks. Welcome to TwoX Labs. I'm your host, Dr. Erika Miley. Now, I wanted to do a quick intro here. I'm still getting a handle on how I want to introduce TwoX Labs. If you're not familiar, I hosted a podcast called Sex Talk with Erika Miley. Still exists. You can go listen to over 100 episodes. 150? I don't remember. I want to tell you that this show is for healthcare providers. This show is for therapists, psychologists, those of you who get continuing education credits to keep and maintain a license. So if you would like a CEU for this episode that you are about to listen to, head over to twoxlabs.org and sign up for a membership. You can listen to this anywhere, from the membership site, from the YouTubes, from the podcasty places. And you can get a CEU for it. Not too bad, right? Not a bad deal. So I can't wait for you to get into the episode hearing from Cairn Yakey. We are talking all about how to see documentation differently in the next coming 4 years in 2025. It's going to be a wild ride. I don't know if I should laugh or cry. And I know that all of you are hearing it from your clients and patients. It's going to be a lot. And we wanted to do this episode. Karen and I talked about it. We were TikTok mutuals, and we wanted to think about documentation with the lens of protection. So I hope you enjoyed the episode. See you on the other side. Hey folks, welcome back to TwoX Labs. I am so excited. I love to meet people on TikTok. Let me just say that right out of the gate. There is a cohort of therapists and clinicians that follow each other and talk to each other. And so I have brought you the wonderful Cairn Yakey. Welcome to TwoX Labs. I'm just so tickled that you're here. Can you start by telling us a little bit about your journey into the helping professions and what led you to pursue your career as a therapist?
Yeah. And first, thank you for having me on. I'm really excited to be here. My name is Karen. My pronouns are they, them. And my journey towards being in the mental health field actually started in 2002. And I started volunteering on crisis hotlines and doing court advocacy work with both domestic violence and sexual assault. And actually, that was when I thought maybe I should become a therapist. I really enjoy doing this. And I was like, no, I'm doing this science degree. It's totally fine. That's where I'm headed. And I kind of stuck with science and ended up with chemistry and photography and was like, oh, maybe I should go to grad school, be a therapist. And I was like, no. And so I ended up spending 3 years in law enforcement. And I was part of the Maine State Crisis Intervention team and kind of continued doing that mental health work just in a different way. And throughout that time, I started working more towards court advocacy again. And then I was like, yeah, I should really get a master's in counseling psychology. And then I was like, nah, I should really pay off my student loans. So I thought maybe nursing. So I did that for a little bit. Then I was like, well, pharmacy, I have a chemistry degree. Like that could be great. Did that for a little bit. And then finally was like, you know what? I think it really is time. And ended up going on and getting my master's in counseling. And it seems like this hodgepodge journey around, but so much of it has actually really made sense and has really impacted the work that I do.
The perspectives you grew through that path. I imagine you have these nuggets of wisdom in the back of your mind that they're probably going to come forward while we're talking about this, but it's still like the nuggets that you picked up along the way must be very vast. So I'm so glad that you're here. And it's interesting. like we actually have some echoes together in some of our early experiences. I worked with a lot of sexual assault survivors early in my career. I still do now, but it was different back then when I was doing casework. But you heard the call of the social sciences. Still a science.
Yes, it is still a science. And I think I, am one of those formerly known as gifted, burned out millennials that went to a magnet school and was like, oh, you have to go on and get like a science degree, right?
Oh, you are just speaking you're just speaking directly to me, Cairn. That's all. That's it. So I want to get into our topic for today because I think not only just with your background, but you and I started having this conversation on TikTok about how, especially the post-election and the threats to so many of the populations you and I serve and belong to, how documentation will need to absolutely look different. And so we're coming at all of our questions today with this idea of rethinking documentation with a whole new lens of protection. And how can we as helpers be really cognizant and think through documentation responsibly. So I really want to start with the basics. In your experience, why is documentation such an essential aspect of working with at-risk populations?
I think that it's really important in the way that it's a way to protect our clients. And my hope is that, someone's able to access therapy and they're able to do that in an empowered and safe way. I really believe that this should be a collaborative process and that part of informed consent is also really educating them on their options, not just for therapy, but it actually translates out to other medical providers and how they can advocate for themselves in other places. And I think that is also really protective and helpful for them to be able to have that knowledge and ability to advocate for themselves.
Absolutely. I think one of the first things that I say to people when I'm meeting with them for the first time is, your medical records are yours. And I'm not sitting over here writing secret notes about you. You're going to know everything that I'm writing about you. You are just as much, you should have just as much knowledge of what's here as I do. So it just coming at it from that team place is what I hear you saying. And there's many of us who come, especially from the community mental health area, like that's how we're taught to document things for everyone, is that co-documentation, that you're working on it together and it builds rapport. I'm kind of curious, what are some of the specific considerations that therapists and medical providers alike should keep in mind when documenting the experiences of marginalized groups like LGBTQIS2S individuals, AFAB clients, or even immigrants? We got large groups that are at risk now.
Yeah, I think that it's really important to ask ourselves and think through what is actually required to put in our documentation. And, part of the ACA code, the American Counseling Association, which is for my licensure, the ethical code that I follow is, it instructs us to actually think about like what is required of documentation, what do we maybe not have to include in order to actually protect the confidentiality of our clients. And I think that it's really important to think through this because, when we're recording demographic information or we are recording medications or maybe certain doctor's visits that clients are having, as laws have shifted and changed, some of that information can be really incriminating if those records were ever subpoenaed. And that's not just for, AFAB people. It can, and a lot of that could look like pregnancy. So trans and non-binary people who are pregnant and expanding their families have some extra considerations as well as, AFAB people who are pregnant. And then I think also when we think about immigration, the way we document can have an impact on someone's immigration status.
Absolutely.
And so I would be really, careful not to document anything, that would possibly, be used against them for their immigration status. And so if anybody, was reporting something to me, like legally, then I would probably, keep things extremely broad and very vague so that those notes would not reveal anything that could keep them from immigrating.
Absolutely. I think we have to, as clinicians, as you're saying, like, think about who is potentially going to read any of this documentation, whether it's the demographics, whether it's the prescriptions, whether it's whatever it could possibly be, whose eyeballs could be on it. Is it an attorney? Is it somebody who is not going to let you in or out of a country because of what is in your medical record? It is. There are a vast number of things that we have to be thinking about in general, but now even more so. I know that we think about documentation as a tool for ourselves as clinicians, but how can it be used to essentially create maybe more bias, or how do systematic issues like lack of awareness or biases contribute to unsafe or inadequate documentation processes?
Yeah, I think that the language that people use in their clinical documentation is really important. I think that there are certain ways that clinical language can be used that can increase stigma or possible bias, not only for, people of color or LGBTQ people, and then as well as neurodivergent people. Some of these places that can just really inherently bring some bias and stigma. And I think also that it's really important for us to consider diagnosis and how either our own bias is impacting diagnostic thinking, or how that might actually impact them in other places in the medical community. As well as, I also think of bias, not even just in the medical community, but also it can have an impact on people who might be seeking life insurance, might be needing security clearance, may want to join the military, be a pilot. So just thinking and being really careful and mindful about all those different places where bias and stigma can come up.
I want to spend a little bit of time here because of your background in serving pregnant people who are trans and non-binary. I think that lens is something that, especially since these populations have essentially been used as a political weapon over the last, how long did we go through the election cycle? Longer than we should ever have to deal with as a people. But when a group of people is used as a political weapon, I kind of want to know your thoughts on that and how bias can be it really impact the outcomes for people.
Yeah. So I really think that, some of that bias can also just really increase ignorance and knowledge of the communities that people are serving. I think that there's a lot of bias out there around, who are trans and non-binary birthing people. And when we have a general sense of, are trans people also predators, that comes into how people view and care for people. Or even systematically, we've noticed even EHRs have bias that if you have a gender marker of M and you were also a pregnant person, it's not triggering some preventative care. And so some of that preventative care that's really important, like gestational diabetes, it really can impact not only their health, their baby's health, but also birth outcomes. And so it really starts to become a safety thing. And then I think another part of that is that sometimes, because of bias and not having enough information or training, people are not getting the support that they need in order to really, expand their families. And so they may not be getting the support they need to know what could breast or chest feeding look like for them and their family. Or they might not know what to do, possibly if they've had certain surgeries, they may not know that they can still breast or chest feed. They may not know that that isn't an option and what kinds of things that they can do to support themselves in a period that will probably be uncomfortable for a little while. But it's good for them to know that in advance instead of finding out and then going, what am I supposed to do?
Yes. Like there are not only just systematic ways that we serve people, but the things like EHRs that we're using have those systematic biases built into them, and people essentially just don't even get access to the care that they need. I think that point you're making is incredibly important. I hope the people are listening or taking notes, because it is. If you are helping serve any of the individuals that we're talking about, we really do need to be thinking with the most mindful lens that we possibly can. I do as we start thinking about what does it mean to approach this entirely different, rethinking documentation with this protective lens. When we think about that, what do you think it means and how it does change our traditional approaches?
When I think about a protective lens, I think about, coming back to that ACA code is, asking us not only what is required in documentation, but also, is it necessary? Is it beneficial to their treatment for me to be documenting and having this as part of their clinical record? And I think that all those other questions that can be really important as well around what would be the implications or the possible impacts if this medical record was subpoenaed and read in a court of law? How would that impact my client? Possibly in a beneficial way, but also in a negative way. And I think it's also very protective to think through the lens of how would my client be impacted if they read this record? And I always think about that because, as you noted before, this is their record. I like to say I'm like the conservator of the record, but the client owns the record. And I think it's really important for us to consider the language we're using and what is included and how that would impact the client.
The conservator of the record. What a wonderfully put way to think about our role with their medical record. I wonder what you think about the idea, because there are times when we can actually correct the record. I work with neurodivergent people across the gender spectrum, across the BIPOC neurodivergent people, and I see tons of mistakes in their record. And especially, one of the most common ones is the misdiagnosis of prior mental health conditions. I see borderline personality disorder, bipolar disorder, things like that, especially for AFAB individuals. And one of the ways that, when you said conservator, I was like, oh, that just kind of hit me. I was like, yeah, me shifting this diagnosis and getting it correct and trying to make sure that none of those other diagnoses are still there can really impact not only just access for them, but it also can impact maybe how the next provider sees them.
Yeah. And I think it's important, and that's part of, in those first sessions when I'm working with somebody and talking about informed consent, I'm also offering them, what does confidentiality look like? What are the limits of confidentiality? How do you access your record? And your right to, also request that a record be, anything inaccurate to be changed in record. And I think it's really important that clients know that they have the right to do that.
Absolutely. Absolutely. The conservator of the record. I'm going to keep coming back to that word. I love it. I think it's a beautiful way to think about this. So I wonder what are some common ways that documentation can unintentionally harm or expose in vulnerable populations such as LGBTQIA2S individuals, immigrants, neurodivergent clients, BIPOC clients.
Yeah. And so I think that some of the ways that I can think of right off the bat is some people, may not be out. And so when we're recording like sexual orientation, gender identity, pronouns, names, that we might be adding things to the record that might not be information that they would tell anyone else or want anyone else to know. I specifically think that a lot. I also work with adolescents. And so, if that is something with an adolescent that, asked me saying, I don't know if my parents would support me. I don't want them to know, I always educate them to let them know, like, here's how I can document in my record, and also know that I will honor and use any name or pronoun or identity that you're bringing in the room. And I think for immigrants, how that might impact their immigration status if they were to have those records subpoenaed into a court, how that could possibly be used against them. I know that there are certain crimes that if they have a history of committing, or certain kinds of, I'm not completely remembering. I have a friend who's an immigration lawyer, but certain types of drug use, alcohol, certain kind of diagnosis that could have a negative impact on their ability to immigrate to the United States. And also history. One that I had just learned, she had told me that if they have 2 illegal border crossings, it can be an automatic, disqualifier for immigration status unless they go back to their country for 10 years and then try again. And so, not thinking about those things and not wanting to put that in the note if somebody had maybe disclosed it. And I think about that in terms of it's not really about their mental health treatment, and it doesn't really benefit their mental health treatment for me to add information like that. So,
exactly.
Such an important lens to think through. And then I often think about, for people of color and BIPOC individuals, certain types of, when I'm doing that demographic information, what are we recording and why? And, can that increase bias, not just for our records and our record keeping, but also for how those records might be read by another clinician who's working with them or another medical provider who is working with them. And then I think kind of specifically for trans and non-binary people, as we're starting to see some of these anti-transgender laws, how that can impact not only their own care. So we're seeing how these laws are impacting gender-affirming care, but also how it's impacting their families. And so what does it mean to record in my notes that maybe a parent that I'm working with has a trans child, and what type of gender-affirming care they're currently doing or are considering, and how that could really impact their family if that was ever revealed outside of my notes.
Absolutely. I as you're talking about it, I'm thinking through having lived in Florida for 5 years, and the threatening letters, those of us who were doing gender affirming care there. I don't live in Florida any longer. I'm no longer licensed in Florida. I did not renew my license in Florida because of the laws that they started to pass statewide to essentially try to eliminate, especially adolescents, from getting gender affirming care, even from social transition. And we started getting letters that were really scary from the Department of Health, from the state. that were essentially like, if you don't disclose to that teen's parent, even though that kid could be in danger, you can lose your license.
Mm-hmm.
And so I did consultations all the time with pediatric care physicians who were wanting to make sure they were giving the most appropriate gender affirming care, and they were terrified.
Mm-hmm.
There's so many of them that are leaving states like that because when a government puts you in the position to lose your livelihood, it does mean quite often that people will leave those areas, but they will stop offering that care altogether. I think as we're talking about this, you and I are sitting in states. You're in Colorado, I'm in Washington State.
Mm-hmm.
Like, we're in states that, as far as affirming care access, that there are laws available. But you and I were talking before we started recording that the things that might change federally may not mean that the people in our states are necessarily safe.
Mm-hmm. Yeah, and I think that, not only, like you were saying, people who are starting to limit that care out of fear, right? And
Yes.
of course, like losing your license and, not being able to work is a very legitimate fear, but also just the lack of availability of care that is now coming about because people are afraid to, provide that care because of legal ramifications.
Absolutely. It is. I keep wanting to go back, Karen. I would keep going back into the Hallmark movie hole in my house. You know what I mean? Like, I want it not only was the election cycle entirely awful, but now as providers, but also all of the people that we care for, we're looking down the road of the next 4 years.
Yeah.
And we're now trying to help our people thread a needle, a very real threat, real threat, while also not letting that fear completely take over their entire lives every single day.
Yeah.
What are you hearing from your people? What are you hearing from other providers?
Yeah, so I am hearing a lot from other providers who are really, really concerned about their trans and non-binary clients, their BIPOC clients, any of their immigrant clients, any of their neurodivergent clients, because they're seeing this. I'm familiar with the minority stress model of like, what does it look like to go through the day, with these different levels of, stress because of marginalized identities. And the amount of things that people have to hold and carry and think about almost constantly. And I think that has shifted a lot just in the last couple of weeks now that, post-election, that people are really starting to consider a lot of things around, do I need to change my gender marker? Do I need to change my gender marker from X back to assigned at birth? Do I need to change my documentation of, I know that for me, I was going through a process of so I have an X gender marker and I was updating my passport and I was like, well, I should probably have everything look the same because I was thinking I wouldn't want anyone to doubt my identity or that something is right or not legitimate about any of my documentation because things don't match. And then also just not even kind of confused about should I even have a X gender marker, but I don't have my passport back. And I was feeling kind of afraid of what do you do with that? And I think that is a very common one for a lot of people because, having an X gender marker on your passport could also impact certain countries that you would be able to go to because of laws in those countries.
Okay.
And, I know that people are considering whether or not they need to update their birth certificate or not. Or whether or not they need to get second parent adoptions when that wouldn't have been legally required before. I have several clients and friends who are seeking second parent adoptions for their children because it's recognized in Colorado, and so their name can be on the birth certificate. But should they travel to another state where that birth certificate or their marriage may not be recognized, do they need to consider additional documentation so that they can really actually legally prove I am this child's parent.
Yeah.
Or if when I think about spouses, I have a lot of, people who are considering extra legal paperwork so that if a spouse is in a state where their marriage might not be recognized, that there's additional legal paperwork saying, yes, this is the person who has medical decision-making power. This is my power of attorney, and like specifically who that is so that, they know who to contact and who has those rights. And I think that has put an immense amount of stress on people and really seeing a pretty significant amount of anxiety in people. I think and I know a lot of people were saying, well, we don't know what's going to happen yet. Don't get too anxious. On the first day of pre-filing in Texas, 32 anti-LGBTQ laws were introduced. And I think
not
there were
3, not 2, 32.
32. And I know that I think there's more that were introduced in other states as well. I'm not exactly sure the number, but 32 on the first day of pre-filing, and we're already seeing, this week, right? Of course, the Speaker of the House, making that declaration that, have to use a bathroom with your assigned gender at birth. And so we're already seeing shifts and changes that are coming.
Yes.
And they're already happening. So it's very, very valid as I'm then sitting with people who are really, really afraid and also trying to really navigate all of these different questions that until about a couple of weeks ago, really haven't had to think that much about.
Yes. Especially if you were living in a state like Washington State, like Colorado, like California, like Oregon, if you were living in one of those states, maybe those things weren't on top of mind. But then this election cycle have brought them to the forefront, and now, and since the election, it's not. I feel like if we say to people we don't know what's going to happen, I have no problem saying this. I think that's gaslighting people. I mean, they put it in writing. They put it in writing what they're going to do and what they're going to try to do, and I think I believe people when they tell me who they are or what they're going to do. And I think that is a healthy way, healthy skepticism of wishful thinking, at least in my
I
experience as a clinician.
I'm like you. I think that people reveal themselves to us by what they're saying and what they're doing. And I think so far we're seeing by what they're saying and what they're doing that it's very consistent. And so I wouldn't expect otherwise at this point. Yeah.
I have no problem saying that the day after the election, I called my OB and said, hey, I know I got 2 years left on this IUD, but I don't care. I want that full 7, please. And she's a lovely human being and said, yes, come on in. We're going to get that documentation right so that it's covered, and you're then covered for the full 7 years that you need. Now, I feel very lucky that I can access that. But those are the kinds of decisions that we're all having to think through now. We're all having to think through all of this in such a different way. So I think our conversation about documentation from a protective lens is necessary. I was listening to somebody talk about, of course, thank you, ADHD Memory, for removing their name from me, but they were talking about when you're dealing with fighting fascist governments of any kind, that one of the things that you have to keep in mind in the early parts is not to give up in advance, to not give permission in advance, to not give up the fight in advance. And I think wishful thinking of we don't know what's going to happen is part of, we have to resist some of that. Yeah, we can't let our nervous system be completely upset every single day all the time, because then we're of no use to anyone. But we can't give up in advance.
Yeah, and I think this is maybe something, I don't know if you've noticed this, but as people have been processing their anxieties and their fears with me, I feel like I generally have a good sense of what's mine and what is my clients or the
Yes.
people around me. And I think that one place that I start to struggle as a clinician is sometimes those weeks, especially like an election week, where something like this happens, and it's almost like I'm kind of processing some of those same fears, and it can
Yes.
be like a little bit more easy to get swept up in what is going on. And I think it's been really important for me to kind of keep reminding myself to come back to like what's mine and what's theirs, but also knowing that, I'm preparing in a lot of the same ways that some of my clients are thinking,
Yes.
until a couple of weeks ago, I would have never even thought to change my name on my birth certificate. It wasn't something that felt important to me. And now I'm thinking about, are there possible legal issues that could come about if I don't? Or should I change my name on my children's birth certificates? Something I never thought about until about a couple weeks ago. Because, for me, I could go, hey, this is my marriage license. Here's my legal name change order. Here's the birth certificate. See, everything adds up. But it's almost like any shred of a doubt kind of almost feels kind of frightening.
Yes.
And I've just also been thinking about a lot of people, and I think this affects a broad amount of people who are trying to shift documentation, get things in order, is the amount of financial burden
Yes.
this is putting on people is really high. So I've been really glad to see that there's been a lot of micro grants out there and organizations that have been helping people, be able to update documentation, submit a name change order if that's something they've been wanting to do but haven't done yet, especially because maybe finances has been restrictive in a lot of these different things.
I'm glad to hear you starting to talk about some of the resources, because I think we're gonna add some resources for clinicians for trainings here in the show notes, because this is going to have to be, this is a sprint. This is not a sprint. Come on, words. This is a sprint. It is a marathon. The next 4 years is a marathon. So we're going to be having to tackle these conversations and thinking through this for the long haul. And I think finding those resources for our clients and patients, but also what are the resources for us as clinicians and trainings. One of the things we're going to kind of start thinking about, like, what does it mean to empower our people through documentation? But I think there are considerations that therapists and medical providers should keep in mind. And a tool like being able to line up all of your paperwork, like you said, can be incredibly, at least freeing, but at protective at minimum. So thinking of that, what other tools using documentation and protecting clients rather than exposing them to potential harm or discrimination? What do you think as far as documentation we could be doing?
Yeah. Well, one thing I kind of want to add before my ADHD tells me to forget is when I think about those resources, some of the pushback I've gotten from clinicians, from medical providers is like, oh, this is really overwhelming. And I think it's really important to maybe reframe this into like, there's a lot of these things that we already do naturally because, our ethical code is requiring us to, protect our clients, to not cause harm, and to keep their confidentiality. And so I hope that by doing this, it's actually reframing it into a way that this actually feels more accessible, because a lot of the things that, I would say to think about hopefully don't feel as overwhelming, because one thing that we can shift and change is our language and our notes. And one thing I do in my notes is I almost use no pronouns at all. And instead, I might use client or the client's name and just, use statements like client reports or client processed identity development, which is another great word to use. It definitely we know that it might mean gender identity, But the person reading the note probably doesn't need to know that. And that's a way that we can protect our clients. We can protect our clients by how we're referring to who they're talking about and their pronouns and gender identities, sexual orientations. When I write in my notes about a client's family, I usually keep it to, client processed interpersonal conflict in, family situation versus, discussing about their mom or their mom's name, and keeping those things out of the notes. And that can both be protected of the client, but also that person's mom. Or, that other person that I'm talking about in that note. Like if I'm using pronouns or discussing possibly their transition or, things that are very specific there, that's another way to out somebody, in a way that they did not consent to be outing in that way or expect to be outed in that way. And so
you're thinking about levels of protection, not only just for the individual that's in front of you, or maybe even the couple that's in front of you. You're thinking about the expanded relationships around them, and how we can be using language to allow for very much a reality, not only just of some of our fears that are happening right now, but generally, like when we're thinking about all people, what would we want other people to not know about us?
Yeah. And, when I think about it, so I do a lot of presentations and education work on, what does it look like to make birth safer for everybody, which is on trans and non-binary birthers. And a lot of people will go, there's such a small population, why does this matter? And it's my kind of big thing about this is that all of these things that we're doing for this marginalized population are actually applicable and increase safety for everyone. And I think, if we look at this of like, it's important to learn and know these things. So not only are we thinking about marginalized identities, it's really for all of the clients that we're working with. How are we protecting all of them?
How are we looking at everyone? I think of accommodations this way. Like, I think of the example I give my clients all the time is, that wheelchair ramp that you use with your grocery store cart? That was actually not there for your grocery store cart. It's there for people who need to use a wheelchair, but that has become beneficial essentially to all of us. So the idea of looking at it through this lens is something that so many helpers out there are already doing. So I love that perspective that you're saying, like, hey, I hear you out there, providers. I know that what we're saying can feel very scary, and this idea of taking this on can feel overwhelming, but the likelihood is you're doing a lot of this stuff already.
Yeah. And I think it's like about what are some of the just shifts in language that might not be that different. Like, what does it look like to not use any pronouns in your work? Or I've heard some people say, I use they, them pronouns for every single client I work with, so that there's a consistency among their note-taking. Or what does it look like to think about what am I including in the note, and is that beneficial for my client's psychotherapy or not? And when I think about it through that lens, when I think about my birthing clients, when they go to a doctor's visit, I'm not taking a lot of notes on what that doctor's visit was about. I don't record how many weeks they are pregnant. I don't record if they've had ultrasound results. I don't record, certain test results, because it doesn't benefit them in their psychotherapy treatment. Do they sometimes process the impacts of those things? Or are my clients maybe talking about how anxiety or depression impacts some of their thoughts or decision makings around certain things? I feel much more like it's appropriate to document something like that, and you can still keep it really, really broad. When I think about my trans and non-binary clients, I'm not recording exactly what surgeries they may be going through or what medical transitions they are looking into, considering, have already done, unless it's really, really specifically necessary for, their access to gender affirming care. And I know that one can be a really tricky one. I often, and I'm very much educating clients on this one, that often I don't diagnose gender dysphoria unless they're specifically, wanting to pursue gender affirming care. Or, I've had clients say, it feels affirming to me. I want that diagnosis. And I, as we have that discussion, I'm also here, I'm journeying with that person, and I want to respect that they're an autonomous human and they get to be part of this process and making some of those important decisions. And so I think that can also be really important when we think about, when it comes back to like immigration status of, I think even like medically, what are we writing about them, or what are they reporting as part of their process, or what's going on in their family, or things that are going on for them. And really, I think it's just about like coming back to, we already know as clinicians to keep our notes broad. We already know that part of protecting the confidentiality of our clients is to kind of keep things vague, right? And knowing, what am I legally required to document and what actually am I not legally required to document, which I think is really important to think about. And in terms of like, what are we collecting in our intakes, in our documentation? When I'm working with people who are not using insurance, I don't even ask them what their sex assigned at birth was. It's not necessary for me to know that.
Exactly.
It does not impact their treatment. And it's not necessary, like legally, for me to document that in their chart because, insurance will require that of me. But if somebody's private paying, then it's not.
Exactly.
And I think it's... Sorry, go ahead.
Oh, you're totally good. You're bringing up so many points that I think that I imagine there's so many people out here listening to the points that you're making, going, oh yeah, maybe I am doing some of those things already. Maybe I am already like thinking through this lens, and it would just require some tweaking of language used, or really paying attention to what is absolutely necessary for someone to document, to get access to what they're needing. I tell my students this all the time. I'm like, diagnosis is not identity. It is not who you are. And yet, though, we have people like what the example you gave about gender dysphoria, still having the conversation, though, about the pluses and minuses of having that in your record, unless it's entirely necessary for you to get access to certain kinds of care. I tell my students, I'm like, diagnosis drives treatment. That is all it does. It tells an insurance company, likely, what we need for this person to access what they need for their brain and their body. The end. And so what do you absolutely bare minimum legally need for that? And so I'm just going to encourage, especially all of you listening who are in community mental health arenas, because they're often, I don't know about you, but for me, when I was in community mental health, there was a lot of documentation that was required, that there was so many times my ADHD efficiency brain was like, why is this here? What is this for? It doesn't need to be here. I don't want to fill this out for my client. Like, it doesn't make any sense. They should just have access to me. So I'm encouraging all of you listening, the community mental health people, push back on the people who are in charge and ask that question. What is absolutely bare minimum legally required for these people to access the care? I mean, do you have your community mental health days popping up in your head?
I do. I'm thinking about, all the documentation that, for Medicaid and how much you would have to write, especially like the demographics and the psychosocial kind of requirements. That's like, why do we need to report this all to an insurance company? Why do they need to know all of this?
Yeah. It's definitely something, I think, as a field, the areas in which there is a lot of documentation taken or required, we really do need to be thinking about it. So I hope all of you who are maybe higher ups in some of those community mental health places it's time to push back. It is okay. I'm getting a lot of complaints anyway from people who are supervisors of the associates coming up that they don't know how to do the documentation. I'm like, that's fair. We all don't want to do the lengthy documentation. The end. We just don't want to.
Yeah. Which, I mean, does bring up an interesting thing as you're saying that, because I know that a lot of clinicians are really, really interested in AI. And I'm seeing, I have concerns about AI, not just any AI, because I think that it can actually be a really interesting and powerful tool for clinicians. But I do have concerns about the implications for people who are using AI to record sessions.
Yes.
That then will be submitted to write a note, and whether or not, like, you know, how does it impact somebody to have an entire recorded session, you know, out there.
I took a look at, I won't name the company. I took a look at a couple of the companies to see, like, okay, what is this like? Because I've used AI to like reword some of my documentation to maybe make it more brief or make it whatever, to just one, shorten time, but also when I'm using an AI, I can keep all of the information out that I want to keep out because I'm the one who's in charge of it. It's not my sessions being recorded. But I was looking at some of these companies that are recording the entire session and then pulling from the session itself. And I'm like, okay, how do I know you as a company are not going to sell all of that dark data to somebody else? And it's a pinky promise in your terms and conditions that, I mean, we know there's already lawsuits against companies like BetterHelp who sold dark data to companies like Meta. So, like, I think this concern is a very real one.
Well, and I know that some of them supposedly don't save the recording on their platform, but I think it does save for the therapist. And I'm just like, data breach concerns come up for me. And I think, I can't remember the name of the organization, but I think there was a substance use treatment center pretty recently that actually had a huge data breach. And some of that information was entire recorded video sessions and client sessions. And I can't even imagine, you know, having that out there. And that's one thing that I look at as a protective thing and privacy concern, right? What am I doing, and how does that increase risk of confidential data getting out? So when I think of, you know, possibly some of the AIs that write clinical notes where you maybe type in a prompt and you don't even have to add, you know, protected health information or client data, and it kind of pops something back out at you, a lot lower risk than recording an entire session and having the possibility that that could be part of the data breach.
Absolutely. And my husband is in cybersecurity, and so I tend to have a very, very healthy skepticism of any of these platforms or any of the data, because yes, there is ease as part of it as clinicians that we're hoping for, but what are the downsides? And we went to school for social sciences. We didn't go to school to know exactly how we need to handle this data of these new kinds of tools. And oftentimes these tools are being trained to us by the companies themselves rather than somebody who is training us to think through, like, oh, what does it mean for where our people's documentation go somewhere that we didn't intend it for it to go at all. And most of us clinicians do not have like VC capital backing to be able to go after people with attorneys.
Yeah. So, and I think like what you just mentioned, I think brings up a really interesting point, because, you know, part of confidentiality and protecting our clients is not only just like, where is that information, but who are we talking to about the information and where?
Yes.
Like, I'm thinking about, you know, how are we protecting our clients' privacy by, you know, not talking in a hallway with another clinician with an earshot of other people, being very mindful about how are we asking and seeking consultation. I see, and I'm part of some Facebook groups where they're private groups, but there's people out there that are putting a little bit too much data that's very identifiable and asking for consultation. And I think that it's obviously consultation is a wonderful thing that we should all be seeking, but like, what does it look like to put that out on the internet, even in a private group where I think I've seen so therapists are also clients at times, and I've seen therapists call their own therapist out on Facebook to say, that's me.
Whew. Oh, there's so many layers here, Cairn.
There's so many layers here, but you know what? I think what I would bring it back to is like with all these layers that we're thinking about, all of these different kinds of decision-making processes that we go through, I think that if we can come through the lens of, I am going to do no harm to my client.
Yes.
I am going to protect their confidentiality. If any records are ever asked of me, I'm going to disclose the absolute minimum required.
Yes.
And I'm going to continue to educate myself and learn and just have that openness of as we continue to learn more and as things change, that we can also have the opportunity to change things that we need to in our own documentation. And I know that that's one that often I think people get overwhelmed with, especially when I think about LGBTQIA+ people, is people are like, oh, the language just changes all the time. And I think that it's also really empowering to know that there are resources out there for that. And whenever somebody comes in my room and uses a term that I'm not familiar with, I'm on TFLAG's website, absolutely, because they have an extensive glossary of terms. And so I know that I don't have to know everything in my session all the time, right? I can hold that and I can go look that up and I can educate myself. I don't have to, be worried about that. And so I think it's really great for us to know that we can continue to seek our resources and know where they are.
Exactly. Our language is always changing. And I do think that the weaponization of the trans and non-binary community has led to some of these ideas of the language is changing around them all the time. It's have you talked to a Gen Alpha kid? They're already I am just now 40 and I'm I should not feel as old as I do when I talk to a Gen Alpha kid or a Gen Z one. My college students that I teach, they love to tease me and because they're constantly teaching me their language. But do I feel angry about that? No, because language changes.
Language changes, and that's why Urban Dictionary is a thing.
Exactly. Yeah, and came up when we were coming up.
Right. No. But, I think that is one, when we weaponize certain things, I think that kind of almost allows us to have permission to stay ignorant or not challenge our own bias. And I think one that comes up often for me is people will be like, oh, wow, pronouns are so hard. I don't know how to change that. Or if somebody, changes their name, they're like, oh, gosh, I don't know how I'm supposed to do that. And it's people get married.
Yeah.
All the time. And
all the time.
And we don't
people
say
get
to
adopted
them
all the time.
We don't put a burden on them wow, this is really hard for me. I don't know if I can do this, right? But we do that for trans and non-binary people. We put a lot of burden on them as if, oh, you're asking so much of me. And this is just very hard.
Yeah. It really isn't that difficult. It just truly is not that difficult. I do want to come back to our therapist friends listening, our medical provider friends listening, and I want to just give them. This is a very nuanced conversation. I think you're going to get some I'm going to drop it in the show notes. There's some trainings that Cairn has, some ideas for folks to go out there and take a look at so that they can get really, really good information from people who are researching some of the laws in lots of different states who can really help us like narrow in on our documentation, but also help the populations that we're serving and the decisions that they're coming to make. So I really, how can therapists work collaboratively with clients to ensure that that documentation reflects their experiences authentically and respectfully?
Yeah, I I think that you mentioned it earlier, collaborative documentation, I think can be really, really empowering for clients because not only are they completely aware what's in their record, but they can also have a say as that record is being made. So there's like a confidence of like, yeah, that's what's in my record. That's what we talked about today. We're on the same page. And I think it's also really important for us as clinicians to be educating our clients on their rights. And I think that's also part of informed consent of what does medical documentation look like? What do I have to include? What do I not have to include? What does it look different for insurance versus, private pay? What are the implications that you have to think about in terms of documentation around, future vocational goals or how like this could have legal impacts on someone and allowing them to know that and make decisions about their record. And I think that also, being able to, not have fear around clients asking about their record.
Yes.
That's one that comes up often. I see that clinicians are like, oh no, like my client requested their record. And what am I supposed to do? And I'm like, well, you're supposed to give it to them.
Yes.
And, and they're like, but what if they read it and they're like really upset by what I wrote? And I'm like, well, why did you write something in their record that they would be upset by? That's why I think there's that really important question around how would this impact my client if they read it? So that's why I don't use a lot of clinical language that has often been viewed as oppressive by marginalized communities in the record because, that's not a way that I can really join along somebody. I'm not here to oppress anyone. I'm here to join along. I'm here to not make assumptions. I'm not necessarily always the expert in the room because I don't live in this person's body. They are the expert of their story and they are the expert on their gender and all of these different things. So I'm here to actually listen to them and what they're telling me.
Yes. The fear. I'm thinking a lot about like the baby therapists and the baby medical providers coming up, not in age, but in earliness of their career. I remember being scared when I was learning that the co-documentation when I was early in my career and being scared that I was going to hurt their feelings in some way. And the reality is the more transparent you are, the more that you are having those conversations out of the gate with your people, the easier it is for you to build trust. And then they know what's there.
They know what's there. And we can also educate them on certain things about their medical records. And I think it's important for them to know that, when I'm working with people, when I ask for sex, I will ask for the sex that is in line with their insurance information. Not because it's important for me to know, but it's a billing issue. And so wanting to make sure they have access to that care. Or if there's certain language that I use because I'm writing a surgery letter or something for gender affirming care, I just explain to them, like, this is what this language means. I know that it can sound cold. Or if I'm asking for certain information, I often am acknowledging to clients, I'm like, I know feels invasive. This is a lot of information that I'm asking you for. And I want you to know that the only reason I'm asking you for this information is because this is the information I need to report so that you can have access to the gender affirming care that you want. And I think that our clients actually really appreciate knowing kind of the why or the how of what's going on.
The details do matter. They do matter to our people. I as you were talking about, I was thinking at the many clients who've come to me who have received a diagnosis they knew nothing about.
Mm-hmm.
And they're like, oh yeah, they just gave me this and told me to go get meds. And this is, I don't really know anything about it. Or they handed me a pamphlet. And I'm like,
Mm-hmm.
what? So I think that you joining, when we join with, it allows for that, not only just the deeper work to happen, but for them to really truly feel their own autonomy and feel that empowerment.
Mm-hmm.
So I just so appreciate our conversation today. We really did nail understanding risks, protective documentation, and all of the practical strategies and things that we need to be thinking about going forward. And I so appreciate you having been here with me. But is there any final advice that you would give our therapists looking to rethink their documentation practices to better serve these populations?
Yeah. I think that know that there are so many clinicians out there that are resources, and they want you to learn. They want you to be able to do this well. And so there's colleagues out there that are also wanting to join with you so that you can continue to learn. And some of that can be through training and consultation. And some of that can also be through therapists that are, like you and I are just putting information out on TikTok because we believe so strongly in these things that we want people to know. And so I hope that you remain curious, remain open, and come from a place where people aren't always out there to just say, you're doing it wrong. And that we really actually, are out there saying, hey, we've been there too. I think I've been in this field for 8 years and I'm still learning things. And so know that you have colleagues around you who, 8, 10, 20, 30 years into this are still learning. And so don't get discouraged.
Yes. Don't get discouraged. And remember, you're the conservator of the medical record. Beautifully put, Cairn. Really, thank you again. Where can our folks listening connect with you or find you in the world?
Yeah, so if you want to go to my website, you can find me at www.cairnjourneypsychotherapy.com. And then I am also on TikTok. My username is at Cairn Journey. And I'm also on Instagram at Cairn Journey Psychotherapy there as well. And those are all places that you can reach out to me or learn more about some of my work.
Thank you again. Folks, thank you for listening all the way to the end. If you would like to have this as a CEU, you got to join the membership. Cairn's going to be there in the membership. You can't even, you'll miss out on all the conversations if you don't join us. So have a good rest of your week and we'll see you next time.
Thank you.